Hi, my name's Ashley. This is for Nrs648, discussion board 2. My patient is a 19-year-old male, college athlete, newly diagnosed with ADHD. We're going to start him on Ritalin for reported symptoms of hyperactivity, restlessness, and inattention in class. He has no past medical history. Okay, Cam, from what I can tell, what you have told me, it sounds a lot like you have ADHD. I feel comfortable starting you on a medication called Ritalin. This medication has been around for a really long time. It's known to be safe and has minimal side effects. I believe this medication will help you focus and feel less anxious. I understand that you have a difficult time swallowing pills, so there's no worries. Good news, we can give you a chewable tablet or even liquid form if you prefer. Because this medication is tailored to each person individually, we're going to start you on a low dose once a day. This way you can take it at any time, every day, at the same time every day, in hopes of getting you into a routine. Because you'll be taking this medication in an immediate release form, you're going to start feeling this improvement within your symptoms about 30 minutes after taking it, and you'll probably feel your best about 1 to 3 hours after. This medication is absorbed into your body pretty quickly, and as quickly as it comes, and almost as quickly as it goes. And what I mean by that is the experience of return of your symptoms late in the evening is what we call rebound, and that's very common. A few things to remember when you take it. You need to take it at the same time every day. You can take it with or without food, but I suggest food to avoid a side effect of upset stomach. Because you're doing a chewable form, I want you to take it, drink a full 8-ounce glass of water immediately after. If you forget your dose, it's safe for you to take immediately. Just make sure it's not after 6 p.m. Or near your next dose. If you don't remember until the next morning, don't take an extra dose. Just start back over on your normal routine. I understand that you've heard a lot of people are addicted or can be addicted taking this medication. You're not wrong. It is a high possibility. Ritalin has a high potential for abuse. However, as long as you're taking it as exactly as I tell you and only when you're supposed to, you have a low risk of becoming addicted. I strongly suggest not drinking alcohol when you're on this medication. It's broken down into your liver. That, along with alcohol, is hard on your liver, so we don't want it to be ineffective for you. We want this medicine to benefit you the best way that it can. In the instance that you have a bad reaction, I know that's one of your concerns. I just want to reassure you that it's an old drug, so it's pretty safe. It has minimal side effects, but we can talk about the things that you need to look for that you need to tell me right away. Most common is a decrease in appetite and weight loss. These in particular, I want you to let me know right away. You're very active, you're a college athlete. That alone is going to affect your appetite and your weight. So these two things together could really get you in a bad place. So if you have a decrease in your appetite and you start losing weight, I want you to do your best to eat. And keep an eye on your weight, and then just report it to me about every other week. The more concerning possibilities are heart palpitations, which just kind of feels like butterflies in your chest, or like anxiety and high blood pressure. Because I know you're unlikely to have a blood pressure cuff on you at all times, let's talk about some of the symptoms that you can identify that could indicate high blood pressure. If you have a severe headache that won't go away with medication or anything that you do, drinking water, getting out of the light, if you have chest pain, if you have nose bleeding or vision changes, I need you to seek medical attention right away. Don't even bother calling me, just seek medical attention. How is this medication supposed to work for you was your other question that I saw. There's years and years of evidence that support that patients are clinically diagnosed with ADHD have great improvement with their symptoms when they're started on this medication. This medication helps block the chemicals in your brain that cause you to feel hyperactive and all these symptoms that you have, and it works to help your brain function in a normal way. I'll have you come back in 3 weeks for a check-in to see how you're doing. If you feel great, we'll keep you right where you are on your low dose. But if you say your symptoms aren't any different, then we'll go ahead and increase your dose until we do. If there isn't any other questions, I'll see you in 3 weeks, and that's it.